June is truly flying by, as well as our His Health series that we've been working our way through this month on our Learn with Lo. So welcome to Learn with Lo. If you are brand new to this, you are jumping into the middle of what we call my His Health series, where we have a whole month dedicated to just the wonderful men in our life. I love working with my male clients just as much as my females, and a lot of times, again, we kind of hear a lot of like hormone health conversations, metabolic health conversations. Sometimes they kind of gear a little bit towards or feel like they're skewed a little bit more towards women, and that's okay because, like I said, rightfully so, us females, we deserve to have our dedicated conversations, but couldn't help myself to make a series dedicated to my men out there because I know a lot of women are also obviously, have men in their life that maybe they care for and are either less than eager to think about their health or maybe a little less proactive about thinking about their health. And so with this series, I've really wanted to dive into what are the most common clinical patterns that I tend to see in practice with my male patients. So if you're, like I said, catching up with this series, we really have been talking about some of those very common clinical pictures, all the way from the classic conversation that all of my men love to have, which is low testosterone. It is a very real conversation. It is a very real thing, but adding more testosterone is not always the conversation, right? It's not always just adding more hormones, because we have to start to ask the question of why. Why is your testosterone low in the first place? Because a lot of times that is where the clues of the bigger metabolic health picture is coming together. Sure, I can come in and give you more testosterone and make testosterone look pretty on paper, but the flaming inferno that is the inflammatory processes that were driving your testosterone low in the first place, they're still there. So that is one of the key conversations we had. Make sure you go back and check out prior episodes for that. And then last week, we really talked about metabolic health. And metabolic health kind of encompasses this conversation that we dub metabolic syndrome. Sometimes it's also part of that cardiovascular risk category. And so we got to talk about this kind of trifecta between elevated cholesterol as well as fatty liver disease and insulin resistance. You truly can't separate all three of those, and in my male patients it's very, very apparent and very obvious. When you have one of those pieces of the triangle, you tend to have all three of the pieces of the triangle working in concert together. Again, a conventional medicine standpoint is really just going to kind of come into any sort of metabolic health situation, and they'll just, like I said, insert some pharmacological therapies, whether that's, here's a statin, here's blood pressure medication, here's some metformin, and we're really not understanding how that trifecta in males from high cholesterol, insulin resistance, and fatty liver, those are all very, very interconnected, and you start to kind of pull one thread and all of the dominoes start to fall in a positive way. So in conclusion of this His Health series, I don't even really know whether this is going to be geared towards like my fellow practitioners that are working with males out there, or whether this is still going to be speaking to directly to the male population out there. I think we can all benefit from this conversation, but what I wanted to kind of wrap up our time with was some of the surprising clinical tools that are built for men, but if you used these clinical tools in your women, it would send them into complete hormone havoc. So I thought it was a cool idea to really talk about some of those unique tools as part of my interventions and strategies that I use with my male patients that I probably don't use with females because it doesn't match their physiology, or it doesn't tend to match more of their like feminine state, that our brain is just wired a little differently around what motivates us, how we kind of guide based off of feel versus guiding based off of objective data. And so working with males, not only are, like I said, some of the clinical pictures that we see a little different, some of the conversations we have are a little different, and you better bet that some of the interventions and the strategies are also going to be different. For any of those practitioners out there, if you don't feel like your treatment plans really differ too much, or your nutritional recommendations, your lifestyle recommendations, they don't differ a whole lot between your males and your females, this might be a conversation you want to definitely tune into, because I absolutely feel like we need better medicine than just a cookie cutter approach that's supposed to apply to everyone. So If you have cookie cutter approaches rocking right now, that's, like I said, not something that we can't address, can't fix. Usually that's just comes from a place where somebody is not going to get the results that they're looking for. Either, like I said, your males or your females, or even a little bit of both. So without further ado, like I said, we're going to really spend our time talking about those tools that are genuinely different when it comes to males versus females. Tools that to me would send a lot of your female clients into absolute hormone havoc if you tried to use them the same way. And that male physiology tends to tolerate a little bit better and a little bit differently. And this is, like I said, requires us to understand that physiology, which is where we've kind of laid the groundwork for so far. So one of the very first tools, I'm really going to go in no particular order. I kind of just framed and referenced this based off of the biggest kind of patterns and thoughts that came to my mind in working between my males and my females. So tool or strategy number one is going to be smart and strategic fasting. Fasting is a big one. If we try to use fasting like the exact same in every single person that sits in front of us, someone is not going to do well, okay? We can't just put every reproductive age female versus a menopausal female versus a male in his 20s versus a male in his 60s. Not all of them are going to respond the same way. Some of them might think you're like the best provider that they've ever worked with, and some of them are going to get really negative results. And so smart and strategic fasting for my males is something that is wildly different between my males and my female population. So if you are a practitioner out there and you've worked with the female body at all, you know that if you try to extend 16, 18-hour fasting windows into a hormonally sensitive female, you probably already seen what happens, okay? It is a cortisol disaster. Your cortisol climbs, your entire hypothalamic pituitary adrenal axis is going to be agitated, your thyroid function tanks, your basal metabolic rate goes down, your progesterone tanks, you have disrupted ovulation cycles. This is like very well established. And most of us are already hopefully pretty cautious here in doing some of those things with our female clients, especially if those 16, 18-hour fast windows include morning, which most often they do. When people are talking about intermittent fasting, most people are talking about like skipping breakfast. I think it's a disaster for most individuals if you know anything about how our circadian rhythm operates, but even more so in females. Men don't have a menstrual cycle, okay? Men don't have a menstrual cycle to disrupt. They do not carry the same reproductive hormone sensitivity and or caloric or time restricted feeding sensitivities that females do. What fasting does in a male body is really mechanistically different than a female, and it's sometimes very, very powerful and very useful, especially for those males that are kind of stuck into that trifecta of fatty liver, insulin resistance, high cholesterol. Extended fasting windows force the body to deplete muscle and liver glycogen. Glycogen is the body's storage form of glucose. So glucose molecules are stuck together. They are trapped with a whole bunch of water, and the body stores it in glycogen. The only two tissues that store glycogen is your liver and your muscle tissue, and it's only in very finite amounts. When you have those prolonged fasting windows, it forces the body to upregulate your insulin sensitivity in order to access fats for fuel. If carbohydrates are not available, your body's got to be scrappy and your body's got to be resourceful. And unless you kind of put your body under some of those strategic fasting windows, the body's going to just always preferentially utilize carbohydrates. So we sometimes, especially with that insulin resistance gridlock that we talked about in last week's episode, that is one of the biggest drivers behind the high cholesterol, the fatty liver, the cardiovascular disease, and one of the best non-pharmaceutical ways to really unlock that gridlock: fasting. Fasting really also triggers temporary but meaningful surge in growth hormone for men, and that can help lead to preserving lean muscle mass. Even during the fast, we can see an increase in some of the muscle activation proteins within the body, and it just helps retrain that metabolic flexibility, and you don't see quite as much of the hormonal downstream effect as prolonged fasting windows in females. So usually with males, what I like to get them them to do, first and foremost, is they have to be able to tolerate an extended overnight fast, ideally stopping eating after dinner, fasting at least a solid 12 to 14 hours, and then opening that fueling window. Then men can kind of get into maybe a little bit more of a 16, 18 hour fast. I personally love longer fasts for males too. 24 hours, 48-hour fasts, obviously within reason here. We're talking like a couple times a month, that we're doing these more significant and more prolonged fasts to really dig into some of those built-in insulin resistance factors that we're trying to break that pattern of. Not that fasting is absolutely free risk to men at all, particularly those that are under high chronic stress or high training load. We have to watch this, absolutely. But the margin for error in men in fasting is much, much wider than it is for the female population. So I feel like, especially when I'm seeing this pattern in my males with high triglycerides, high fatty liver, high cholesterol, insulin resistance, strategic fasting is a big one. So that is a unique tool that, used the same way in your females, you're not going to get the same result. Just word of warning. Tool number 2 is going to be zone 2 training specifically, and strength training. When you think about, like I said, this fatty liver, high triglycerides, high cholesterol, insulin resistance, the body is unable to access fat as a fuel source. And so especially when we can utilize exercise, movement, it activates a whole pathway that we call non-insulin dependent glucose uptake. That's a big mouthful, right? Essentially what it's saying, that at the cellular level, it is one of the few mechanistic things that we can use independent of insulin. We do not even need insulin to be secreted to take glucose up into the tissue. That's what muscle contraction does. For males, implementing exercise and movement where there is not exercise and movement happening, just such powerful medicine. Not saying that it doesn't for females. It absolutely does. But females have known that. They can see that firsthand. They're like, I'm eating super clean, I'm moving my body consistently, and nothing's happening. Versus men, you kind of just push them a little bit. You get them practicing what we call progressive overload, get them in the gym 1, 2, 3 times a week, working those big muscle groups, working in progressive overload, maybe even working in some like HIIT or some high intensity interval training, and you just watch, like, we see so many positive metabolic benefits across the board. It builds their overall mitochondrial density, which helps them access and burn fat faster. They're going to start to clear their triglycerides. They're going to start to lower their blood sugar, reversing some of the fatty liver patterns. When you reduce the insulin resistance, their testosterone naturally goes up as well too, because insulin resistance puts a gridlock on overall testosterone production. So it's just one of those things where, like, strength training, cardiovascular work, and again, obviously we still walk through the progressive overload of this. You're not going to start from doing no training to doing 6 days a week training, but it's like the building of the lean muscle mass, the muscle contraction that is even just walking, using your muscles, resistance training, like that is glucose disposal. And it's not just during the workout. It continues well beyond when the workout is done. That's how powerful it is, especially for males. So usually the male physiology tends to tolerate higher amounts of training volume as well too, higher intensity without any of the hormonal disruption that usually the female physiology does. They try to like work out more, run more, exercise more, and they just end up feeling like puffy and fluffy for females. Whereas men like instantly notice that like their anxiety is better controlled, they sleep better, their testosterone is up, their triglycerides are down, their blood sugar is down. Like I would say for men, undertraining is far more common than overtraining is. And for females, it's like the exact opposite. I would say overtraining is way more common than undertraining because females aren't understanding that their tolerance for volume specifically and intensity second is not as high. And so we have to be, like I said, a lot more strategic about it. But for my males, I'm like, let's go. And it tends to work really, really well. In conjunction with that, tool number 3 that I think is very helpful for my males, not that it's not helpful for my females, but I love it really for my males, is I put it into the category of wearables, wearable devices. Now this could go anything from like a Whoop band, an Apple Watch, an Oura Ring, all the way to some of the other wearable devices like a continuous glucose monitor. My dudes love data, and I love data too. Like in my masculine, I'm like, yeah, let's like get some data behind this. But there's just something about the male brain that like they don't necessarily feel as well as they can like objectively put data behind it. So it's like if you ask them like, how's your stress? They're like, oh, I'm fine. Everything's fine. Meanwhile, you slap a wearable device on them and their HRV is in the toilet, right? Or they haven't had a drop of deep sleep in the last 5 years. And they're like, oh, I feel okay. I sleep good. And it's like the devices and the data and the wearables for guys is such a game changer because it can help put data to things that they can't quite feel or connect or always be aware of. So I love getting my guys connected to some wearables just so that we can verify. Obviously, labs is very helpful for guys as well too, which we'll talk about in a second. But stress markers, like getting them to realize like how stressed their body actually is, regardless of how they like functionally feel about it, their HRV score, their resting heart rate, their overall deep sleep values is huge. Also, I think even just sleep scores, a lot of times guys may not even know that, like I said, they snore, they have sleep apnea. Most guys that have insulin resistance do. And so even just being able to look at their sleep or even being able to tell them like, hey, do you realize that growth hormone is secreted between the hours of 10 p.m. and 2 a.m.? And so if you want to increase your testosterone, I gotta have you getting to bed early. Every hour of sleep before midnight is like doubling your growth hormone excretion and therefore your testosterone. So even just being able to make some like connections and some trends for guys and giving them the challenge of like, hey, I want you to take your deep sleep from 20 minutes to 40 minutes. That can really be a motivating factor for them as well too. And then the last tool number 4, I kind of mentioned it already, but it is recurring and frequent blood work. Obviously we can use specialty labs as well too, like stool testing, toxin testing, hormone testing, but we can get blood work consistently, like every 8 weeks, every 12 weeks. And that is so motivating for guys, especially if you can show them their cholesterol is coming down, their triglycerides coming down, their testosterone is going up, their fasting insulin levels are coming down. Like I said, my dudes love data, and that objective data really helps us kind of overcome maybe some of the subjective things that they can't quite always articulate. Whereas with a female, sometimes I almost feel the opposite. Sometimes like we're so in touch with our body, I'm like sitting there and I'm like, do I even need labs? Because they can probably tell you what's going on here because they're so in tune with like, my body feels this way at this time and this way at this time. And if I eat this, then it feels this way. And there's like so much subjective data that I'm like, yes, I can kind of deduce what the data is going to look like. Whereas with a guy, they're like, yeah, I'm good. It's okay. Yeah, my gut kind of bothers me sometimes, but it's not bad. And it's like, I don't really feel stressed. And it's like, I don't have a lot of subjective data to go on here. But then if we look at blood work, we look at wearable devices, that's where we can really start to inch out some of these like very real interventions for us as well too. So 4 major tools: smart and strategic fasting windows, implementing more training volume, more training intensity without worrying about the hormone payoff, wearable devices for males, and regular and consistent blood work, especially the blood work markers that we've been talking about this whole series, making sure that we're running things like free testosterone and total testosterone. We're not just running a fasting glucose, but we're running fasting insulin. We're looking at inflammatory markers like HSCRP and homocysteine, right? It's like we're putting the pictures of the labs together, not just like running basic labs, that's not going to be motivating for anybody, but like running the right labs and under the right context can be a game changer for guys as well too. So these tools, like I said, can also work well in my female clients, don't get me wrong, but my male patients tend to really see some success using some of those more unique tools. So if this was helpful, like I said, share it with the men in your life, as well as know that with these strategic tools, we can kind of put some real data to them as well too. And that's where going to the link in my bio and snagging a time for like a functional wellness consult where we can draw some blood work labs and really come up with a plan around this can be such valuable information for my males out there as well too. Hopefully this His Health series was something that, like I said, you guys enjoyed. Share with family and friends, and we'll be back for more.